So foreign-born doctors and nurses don't have the quality of those that are British?
They don't have the compassion.
What?
Right? I've listened to this Gary Lineker thing, and I've been listening for a while about the immigration and everything, and people coming on the boats, and it is very tragic. You know, I'm a big believer. I'm a compassionate person. It is God's earth at the end of the day. But the reality is that Gary Lineker, with his statement, has never probably tasted a waiting queue in a hospital. Just to let you know, I've got 2 daughters, both in public service. Okay, one's a police officer, one's a teacher. And I've got a best friend that works in the NHS. So I've got pretty close to what they go through without being specific. And I think that the first thing we've got to do, really, is to switch off the life support machine on the NHS. Because we've got to ask ourselves what makes this country so attractive for people to travel to. I'm all for... You see, the thing is, it's a bit like they always said, didn't they, when you put the Greek... I know I'm shifting a little bit, but when the EU first invited the Greeks into the same economy as the Germans, guess what? It didn't work, and it still doesn't work. The Greeks are forever paying debt because their economy is made up of different things.
What are you proposing we do, Phil?
The proposal is that we... If people want to come to this country, it's not just to escape persecution, but to live a better life and be prosperous or whatever they want to do, is the first thing they need to do is learn the language, because you're not going to prosper. I mean, me personally, I'm thinking about going to live in Thailand because I think the Great Britain, the great's gone out of this country at the moment. So I'm thinking about to go into Thailand, but all the time I'm saying to myself, well, I can't do those jobs. Can I prosper not being able to speak Thai?
So you'll learn Thai when you go there, Phil?
Well, I may not go there because it may affect the opportunity for me to do anything that will be successful. But
why wouldn't you just learn Thai?
Because at my age, at 55, with the greatest respect, if I was 15, I'd learn Thai quicker than 55.
Okay, but if a 55-year-old migrant comes here, you'd expect them to learn English? No, what I'm saying is what we need to be thinking about is for what reasons they want to come to this country. I have come across people in most recent years when I talk about lifetime, and they're not, let's say they're not UK nationals, and they're absolutely focused on having a life in their own country, but having a property in the UK for when they get old. Because guess what? We're all going to get old, for the free healthcare. So unless you've been someone on the front line on the NHS... So do you think it's the free healthcare that people are coming here for?
Well, you answer my question. Why do people travel to this country?
Why do you think more are staying in France and Germany and Italy and Spain?
Why do I think more migrants are staying there?
If it's all about free healthcare, they'd all be trying to come here, and they're not. Most of them are staying in Europe.
No. Yeah, but, you know, since we've opened it, forgetting Brexit, since we've had the free movement of people, I don't know when that was, but,
But we don't have free movement of people.
Say again, sorry.
We don't have free movement of people.
Well, what I mean was, we before Brexit, forgive me, I'm not a politician, I don't monitor everything, but there was definitely, we signed up to something where you can move around Europe and that you could have a free movement of people within the country.
Yeah, within the EU, yep.
So, that's right. So basically, what I have to say, going back to the Greek economy against the German economy, and I'm all trying to be under the euro and all trying to put the same things in, you can only do that if all those countries offer the same services. So what I'm saying it to you is you've got an NHS that doesn't work, that's costing this country £200 billion a year.
So what do you want us to do with the NHS, Phil?
I want to scrap the NHS.
And do what instead?
And have private health care. And how you get the private health care is via the HMRC.
Why would you do that?
Taxes.
Why would you want to do that?
Because we do live in a... It's Ben, isn't it? Sorry, it's Ben.
Yeah.
So we do live in a society, Ben, unfortunately, that everything that's free gets abused.
But who's abusing the NHS?
Well, everything that's free gets abused.
Who's abusing it?
Okay. Well, you know what? The problem that we've got is, that everything has to be... It's like we could talk all night.
But no, Phil, who's abusing it? My mum had to go to A&E a couple of weeks ago. Is she abusing the NHS? No, hang on a minute. So what was your mum's experience like at the
Pretty shocking.
Shocking, right? Shocking.
But why do you think that is?
I've recently, as recent as 5 days, had a procedure done with the NHS.
Phil, why do you think what do you think the problem is, and why do you think that privatising everything is going to make it better?
Because if you privatise it, you get your insurance and you pay for insurance yourself. If I want to find a hotel, I'll go on TripAdvisor and pay the best hotel that I think fits my needs and pay the money for it.
But I don't understand who you think is abusing the NHS.
There's too many people using the facility because it's free. And once you do that, all we're doing is throwing more and more money every year.
Is it migrants that you are saying are putting too much pressure on the NHS, Phil? Is that what you're saying?
I'm saying as your population grows,
yeah,
something that's free, and we are.
And what about all the foreign-born doctors and nurses that keep the NHS running?
Yeah. Well, all the foreign-born. Let me just say something. So what's changed from 30 years ago, when the majority of the people that worked in the NHS were British?
Yeah. What's changed is they've all gone abroad because half of them have gone abroad because they're not paid enough. That's what's changed.
Precisely. So the quality has gone out the NHS, and what we're doing now is
foreign-born doctors and nurses don't have the quality of those that are British.
They don't have the compassion.
What?
Right? And I've used I've used the NHS in the last 5 days.
Foreign people don't have the same compassion as British people. Is that what you're trying to tell me, Phil?
I'm not trying to tell you that. I'm telling you that. Listen, at the end of the day, what we've got is, we could talk all night about this, which would be great, but the elderly in this country that have seen warplanes coming over this country, in my opinion, should get a different.
And talking of compassion, which other European country is planning to lock up vulnerable child refugees and then deport them? Is that the compassion? Is that the sort of compassion we're talking about here?
But what you're doing is you're making good press, aren't you? You actually.
No, I'm asking you.
You're dramatising it all.
I'm asking you whether the compassion that you think is unique to this country extends to locking up and deporting sole children who have travelled over on small boats.
So let's just for 1 minute. So if we keep growing the population of this country,
which is growing because people are getting older and living longer, not because of migration.
Hang on, we need to keep throwing billions of pounds into a bottomless pit called the NHS that doesn't work, Ben. It doesn't work. The quality of care in the NHS, you're on a conveyor belt. I tasted it 5 days ago, okay? I'm saying there's several things that need to happen. We need to shut that monster down for starters, and that might make people realise that there isn't the gold on the streets that we think.
And all the people who live here now, they just have to fork out for insurance. Well, that's the compassion you want to see.
You know, you pay through. Who pays the $200 billion a year to fund the NHS? The working man.
So the compassion that you want to see, Phil, is people already struggling to pay their bills, seeing their NHS abolished and privatised, and they're going to cough up more money in order to see a GP.
No, because it's all relative, isn't it? So if I earn £500,000 a year and I pay into the HMRC 50% tax, if I'm earning £50,000 a year and paying sort of 30% tax, I'm still entitled to self-health care. It's not if I'm ill, I get the same health care as the £500,000 man that's ill. That's not the point. There's an easier way to do it than that. But what I'm saying is, and this is the truth, Ben, I'm not making this up, I know people that are non-nationals that are absolutely saying that they want a house in the UK for when they're older and a house where they come from. And I'm not
I'm not doubting that you know one or two, Phil. But I know a lot of non-nationals that are keeping the NHS propped up. I've spoken to non-nationals who came here fleeing the most awful persecution and horrors in places like the Yemen and Syria. I know people child refugees. I've spoken to child refugees who, if this policy goes ahead, wouldn't have been given the new start and the safe haven in this country that they were given. They would have spent weeks behind bars and then deported to God knows where. That is what we're talking about here. I don't really see how privatising the NHS has anything to do with it, but you seem to think that people who aren't born in the UK lack the compassion that we do, and in the same breaths seem to suggest that we are right to be locking up children who come here unaccompanied. Not sure how that works, Phil.